The 340B program is to help us care for our patients in our community by stretching limited resources to meet really an unlimited need.
About 45% of the population that we take care of are indigent, meaning that they fall below 200% of the federal poverty level.
Either they're uninsured or underinsured, and so the hospital uses the benefits of the program to help provide additional services. So a great example is our outpatient pharmacy has 70% of the scripts that we fill are for patients that don't have any way of paying for their prescriptions.
And it's part of our mission to treat those patients with respect and dignity and provide them with equal care to any of our other patients within our population.
We work very closely with the health department, with some of the qualifying programs there, with the FQHCs. We even have programs with the homeless, in fact, to offer care to those patients as well.
When they go to our pharmacies, we don't just give them improved access to medication, but also improved access to providers. Emergency department visits went down 47% for that population. Hospitalization went down 37%. So was that an impact? Most definitely.
Well, I think a lot of these patients would fall through the cracks. You know, we are the only access to medical care that they have, and those patients wouldn't show up if we didn't have 340B.
Apexus' mission from the federal government was just to get better pricing than 340B, so to get lower pricing for all those entities. But it's really grown since then. So they not only do it for drugs, but they do it for a lot of other things that help us operate, non-drug supplies, if you will. They provide data, and they also now are starting to take a more prominent role in the education of the 340B program.
They are a valuable partner to us in the 340B program. And what they deliver to us is expertise on how to fully utilize the program that's available to us.
They have an excellent website, just a number of programs that are set to help enhance 340B and also to ensure that the integrity of the program is maintained. And they're very responsive.
We created what's called the Apexus Answers Call Center. We work very closely with the Pharmacy Services Support Center and the Office of Pharmacy Affairs in handling and triaging these questions that come in. It fits in nicely and it complements the whole 340B University concept.
340B University, it's all about integrity of the 340B program.
340B University was designed as a way to help fill in the gap of information for facilities that had new employees coming on in the pharmacy that were going to be working in the 340B arena, for those facilities that had been using 340B but really needed to get a deeper understanding.
You get the 340B University, you have Apexus Answers, and they're providing the right answers. So I think that's very important for the integrity of this program as we continue to go forward.
I would say if you're a covered entity, the first thing you should always do is make sure you sign up with Apexus and the PVP. You're gonna get sub 340B prices for things they negotiate with. You're gonna get products that aren't even requiring to be under the 340B program, which they've contracted with. You also are going to have access to resources that are critical for you being able to maximize and better understand the 340B program.
It's a great team of folks at Apexus. They're committed to patient care. They're committed to providing access to pharmaceuticals to us for the right reasons, and that's to take care of patients.